Thank you.
We're almost done, you'll be glad to know. But I am going to tell you the meaning of life, as promised. So we're just going to go through this rather quickly. Anybody figure out the answer to this yet, what this person's screaming about? Okay, yeah, that's fine. Thanks for coming, Gene. Okay. I'll tell you later. Wait till the end of the talk. I will tell you, that'll come to the end of this. So the advantages of having a tinnitus clinic, we're so glad you're here, is you're going to be able to help patients, you're going to provide more complete overall services, you'll increase the referrals, and many will require benefits from hearing aids. So this is a good thing for audiology in general. The disadvantages is you need to know what you're doing. You have to have some kind of plan. The services are often not covered by insurance, and some patients are very deeply distressed by their tinnitus. So workshops, lots of books available, lots of journal articles. These will be available on the website for you. Starting off with some kind of evaluation, the first thing usually is what kind of hearing aids. Does the person need hearing aids at all? What kind of problems do they have? What are their expectations? Why did they come and see you? Have they tried some things already? Do they have hyperacusis? Very important, I say this in the group session, I say this to patients twice. There are no medications that have been shown to reduce tinnitus in controlled studies that are repeated. I often have to say that to patients twice. Different kinds of patients. For some patients, they're just curious, they just need some minimal discussion. Some are very concerned and need to go through different situations, different options. They want to know what is available. Some patients are distressed. You might not be able to help everybody. There are some patients who I have to say, I can't help this person. This person wants more than I can give them. Referrals, if necessary. The group session is a great place to start. It's cost effective for the patients and for me, for us. It can include the partners, and they can appreciate that other people have similar problems than they do. And there's a great chapter on group sessions by Newman and Sandridge in the clinical protocols trial. Some patients actually consider suicide, and some do commit suicide. So this is a scary thing for me, but it's something that we have to deal with and face. So you can't be afraid of talking about this. Have you thought about suicide? I have actually marched patients down from our Odo clinic to the psychiatric clinic. So there's issues about that. If they've actually made some plans, then you really need to be worried. A lot of patients, some patients might say, well, I've thought about it a few years ago, or I'm concerned. And then you can make a referral to a psychiatrist. Some of them may already have been seen by a psychiatrist. Lots of handouts. We often offer these self-help books to patients if they purchase a device. The American Tinnitus Association has great brochures and resources for them. Often helpful to have devices in your clinic that you can demonstrate for these patients. We have asked patients what they wanted for a treatment and did a publication on this. And this shows that really what they want, this is the number of patients. 0, I don't want it at all. 100, I'd be happy to have that. What they want is a pill, okay? A lot of them will accept external devices like maskers. They're ready for cochlear implants as well, and some of them will even go through brain surgery. So, interesting. There will be a cure for cochlear implants, and I think a tinnitus, a cochlear implant, is certainly one viable option. These are results from the Tinnitus Primary Function Questionnaire before and after getting a cochlear implant, and you can see in these 11 patients, their tinnitus severity reduced in all the subscales of the Tinnitus Primary Function Questionnaire. This is a study we did where a patient had a hearing aid in one ear, a cochlear implant in the other ear. They alternated between 2 different background signals on every other electrode in the cochlear implant every other day, and the cochlear implant was successful on every other electrode. They could still hear speech and function as they always could. And one background signal was more efficient than the other. Prepare yourself, evaluate tinnitus in reaction to the tinnitus. You've got some background now. Some of you had already here with lots of background. Each patient is an individual. You need to consider that clearly when you're working with these patients. And our experience is having a group session is a good place to get started and then focus your individual patients on those individual needs.
Do you have your group session like an outline on your website that we can?
We can, yeah, and there's a great chapter in there also, but in the book. And I'll put that book chapter on there too.
Okay.
Yeah. So when I travel, I often like to work in a coffee shop. So in this coffee shop, here's this person had painted on the glass window of the coffee shop the scream. And I thought this was wonderful because I have ties and socks and everything with the scream. And so I'm looking around, and in this coffee shop, they have spilled their coffee, and that's why the scream is there, right? So now we know. Now we know.